Mosaics offers a model that is completely unique in our community, our state, and we think potentially, possibly our country. The ability to access that type of innovative navigation-based services in order to connect people to mental health resources who are not only tailored to what they need, but able to provide care through appointments that can actually be accessed, all at no cost to the patient themselves. I don't see a parallel option anywhere else for my patient base.
If places like Mosaics weren't around, I couldn't imagine. I could honestly say I probably wouldn't be here.
I know that each one of the referrals that gets sent over to Mosaics gets treated, quite frankly, like it's the most important referral that needs to be managed on a given day.
When someone first reaches out to Mosaics, we take the call, we'll do a brief intake with them, get their name, contact information, insurance if they're using it. Sometimes people will call in thinking they need a psychiatrist. Well, that's not really what they need. They need a social worker or a counselor, but they don't know the difference. So then we educate them on the differences in the different providers. We will go into our database, we will research each provider and see which ones we think would be a good fit.
They also will follow up with our patients over a period of time to check and see, just because they got these options, were they able to connect with them? Were there barriers to providing care on the provider side from the referrals that are made? Even if 6 months goes by and circumstances change, we at Mosaics don't really close the book on anyone. Nobody's file is ever completely locked. There's always the opportunity to get additional care moving forward.
They have the heart, the compassion. The thing that I love the most about Mosaics is their presence in the courtroom. And so when that juvenile comes to me for an initial detention hearing, Mosaics can get right on it, finding the team for this family.
Success to me means linking a person from our community with a provider who has been a good fit for them, and that they continue to further their journey with their mental health or their addiction issues. Without the support of our communities, fewer people would get the help that they need when they reach out.
When we think through what to do about how to keep this organization going, I think it's an ongoing source of necessary dialogue, because I would fear dire consequences, not at just the individual, but also the community level. Mosaics is ultimately irreplaceable.
To make that investment in Mosaics, you're changing so many lives down the line.
I'm just very much more present in my kids' lives and my family's lives. Just being there for them the way they actually need me to be there. If places like Mosaics weren't around, I couldn't imagine how many people making it. You can feel the love there, you know what I mean? Like we need more places like that.